Operations Manager, Juan Melli, took home his new son, Christopher, from this hospital today. The sale of HUMC to HUMC Holdco is critical to the life of our state's oldest hospital that serves not only Hoboken, but provides essential services for Hudson County residents as well. With the city's $52 million bond guarantee of the hospital, the successful sale is also crucial to the financial health of the city of Hoboken. Without the sale to the principal owners of Bayonne Medical Center, our hospital simply cannot survive, and our city's finances will be severely impacted. Unfortunately, the financial health of HUMC recently became so dire that it was forced to declare bankruptcy. Without the resources to pay its growing debt, the hospital simply could not even pay its past debt to keep the lights on. In order to protect the safety of patients and hopefully reach a final sales agreement, a decision was made by the management company, HHI, to declare bankruptcy. Since the bankruptcy was declared, there's been an enormous effort to ensure the successful sale through the bankruptcy process. The process has included the negotiation of a settlement agreement and amended asset purchase agreement that had to be approved by the buyer, the Hoboken Municipal Hospital Authority, and the Hoboken City Council. I do want to give special thanks to Councilwoman Marsh, who thankfully was able to call into that council meeting from Nicaragua despite a family medical emergency, and without her 5th vote, the settlement agreement would have failed. In order for the sale to be completed, the settlement and the financials of the sales transaction must be approved by all parties involved in the bankruptcy proceedings. In fact, right now, the creditors committee is having a call to debate the latest offer and decide whether or not to accept the new proposed terms of the sale. I am looking forward to that call from the courthouse any minute, and I will tell all of you, we are this close. I want to say, we are this close to having this deal go through and saving this hospital. So I also want to say, just give you a little bit more background on what we've been through to get to this point. Again, figuring out a way to have enough funds to provide to the creditors so that they agree with the sale has been a major challenge over the last several weeks. At what felt like was the 11th hour negotiations at the federal courthouse, when it appeared that no agreement could be reached, that the sale was going to fall apart, I decided to ask the City Council to support a $5 million bond on an emergency basis. I did this so that both Hoboken University Medical Center and the financial health of our city could be saved. The state told me they could not put in any additional resources. I was stunned by the council's decision that they would rather be in a position, quite frankly, to blame me for the closure of the hospital than to rise above partisan politics to save our hospital and the finances of our city. I needed 6 votes to get that bond through, and I could not, the minority council could not find a way to rise above petty politics. Thankfully, when Governor Christie learned of the Hoboken City Council's actions, he felt compelled to stop partisan politics from taking away your jobs, from taking away 1,300 jobs in the state's oldest hospital. I thank him so much for helping to save Hoboken University Medical Center. The governor's actions have helped to ensure that nearly 2 years of tireless work by dedicated community volunteers on the Hoboken Municipal Hospital Authority will hopefully soon come to fruition. I thank all authority members from the bottom of my heart for taking on the monumental, unimaginable task of trying to save this hospital. Tony Tamarazzo, the chair, who's here with me, Steve Roski, the finance chair, Dr. Kozel, and Dr. Fahimi, who are here today, thank you for working together to try to perform a miracle. Hopefully today we will hear a final decision from the creditors committee and soon learn that they support the sale of Hoboken University Medical Center. Based on the fact that over, I am told, 93% of the employees have applied for jobs under the terms offered by the new buyer, it is clear that HUMC employees want to keep this hospital alive. You want to continue to serve this community for the way that you have served it for over 150 years, and I thank you so much for your service to this community. I hope that your union leadership will listen to you, has listened to you, and that they today will cast the yes votes that are needed to support the sale and preserve the jobs for their rank and file, all of you standing before me today. Last night, the creditors committee asked for a dollar amount beyond the additional $5 million that was offered by the governor. And we were able to increase the available amount. And we hope at the end of the day, they will do, the creditors committee will do what is right for themselves, their membership, and our community. So again, we're standing by. We are this close. I thank you all for your dedicated service. And we will be putting out as soon as we hear, you will hear. We will be putting out a notice, or if I get the call right now, I'll be announcing it. So with that, I will take questions from the press.
What's the new dollar amount, and how were you able to add that?
At this point, I can't disclose it. It's since it is we're in the middle of negotiations. If you want to, I'm going to invite the chair to come forward and help me to answer your questions. So yeah, since it's in negotiations, that's not something that we can reveal at this time. We can discuss at this time. It's confidential negotiations.
Also, where the money's coming from?
It's at this point I will say that the state, neither the state nor the city is putting in any additional funds beyond the $5 million. Any additional?
Mayor, I'm sorry. Who is the potential buyer if this goes through?
So I want to say to the employees that Tony and I will come around and answer your questions. I'm just going to take questions from the press right now, and then afterwards, if you want to stay, I will come around and be glad to answer your questions. Sorry.
I'm sorry. Who is the potential buyer again?
It's the principal owners of Bayonne Medical Center.
And how confident are you this will go through?
I am optimistic that it will go through. I'm extremely hopeful that it will go through, but again, it is down to the wire, and we're hopeful that we have the votes on the creditors committee and that they will vote to support this.
And if it does go through, explain. Just decide to leave and explain what happens.
So if this does go through, if they vote yes today, then there will be a hearing on Tuesday. The consent order will be entered, and there will be a hearing on Tuesday, and then the projected closing is for October 7th. Yeah, no, closing of the sale. Closing of the sale. So he just asked, his question was, what happens if the creditors committee votes yes? So if the creditors committee votes yes, there will be a hearing on Tuesday in front of the judge. So to review the consent order, review the settlement agreement, review the sales agreement. And assuming that if, the judge, basically if the committee votes yes, it's very likely, we can't say definitely, but it's very likely that would be approved by the judge on Tuesday. And then there needs to be a 14-day period where any appeals can be made. And then they're trying to have the closing on October 7th. That is the target date at this point. I can't say that that's definitely the date, but that is the target date. So now, when I say closing, I meant the closing of the sale and saving of the hospital.
Mayor, other bidders are starting to go public. Do you still stand by that this deal is the only way to save the hospital?
Yes, I do. Do you want? I absolutely do.
The RFP process that was undertaken by the Hoboken Municipal Hospital Authority was very thorough. We looked very carefully at all of the proposals that were submitted, and we used a number of criteria, one of which was that you had to have the funding to be able to effect the transaction. And sure enough, we see how complicated it is to get to this final sale to preserve this lifeline hospital that we have. The other bidders that we looked at was the unanimous opinion of the Hoboken Municipal Hospital Authority that this deal with the primary owners of Bayonne was the deal that would get us to the finish line and meet all of the requirements that we set out in the RFP, which was to maintain this hospital and all of the services. And that this bid and this proposal and this buyer is the one that's going to bring that vision to life in Hoboken for us.
And I will say, it's taken, I mean, it's